Hi, I'm Rosemary Clay, the Executive Director for the Bergen-Newbridge Medical Center Foundation, New Jersey's largest not-for-profit hospital, and the sponsor of In the Know with Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Darian Eletto. She is a licensed professional counselor who began her career at Bergen-Newbridge Medical Center as an intern. In her time at the medical center, she has worked as a staff clinician in the acute partial hospitalization program. While at the partial program, she created and facilitated the LGBTQ plus group curriculum for the patients in addition to educating staff on providing cultural competent care for their LGBTQ consumers. Her work with the LGBTQ plus patients allowed her to become the mental health provider for the Bergen-Newbridge Bridges LGBTQ Health and Wellness Center, assisting with the creation and implementation of the center's opening and present mental health operations. In her current role as the Wellness Navigation Specialist, she manages Bergen-Newbridge Medical Center's Federal Suicide Prevention and Response Grant. In her position, she identifies patients who are experiencing a mental health crisis in need of care coordination within the hospital as well as in the community. She facilitates care and collaborates with an intervalent team to ensure that patients supported during this critical time in their treatment. Through her work with the SPR grant, she has created and now facilitates the suicide prevention group called Hope Over Harm on the inpatient units while training staff to facilitate the group in the outpatient level of care. Ms. Eletto obtained her master's in education from William Patterson University and is also a licensed clinical alcohol drug counselor. Additionally, she is a nationally certified counselor and is a graduate from Bergen County Crisis Intervention Team. Pride Month is a time for the LGBTQ community and allies to come together in solidarity to celebrate and embrace identity. We want to remind our families and caregivers that your support and acceptance of the loved one's sexual orientation, gender identity, and/or gender expression directly impacts their mental wellness and personal safety. LGBTQ individuals are more likely to experience a mental illness such as depression or anxiety, and the stigma that surrounds mental illness can keep people from seeking help. Today, Darian and I will discuss some of the challenges and how we can support the LGBTQ community and become a supportive allies. Hi, Darian. How are you today?
Hi, Ro. I'm doing well. How are you?
Good, good. Do mental health conditions affect the LGBTQ community?
Absolutely. Gallup recently did a survey in 2020, and in the survey, they identified that 5.6% of Americans identify as LGBTQ members of the community. So think about that number with our current, the current population of the US, which is like 332 million. So 5% of that is 16 million people. So of course, this population is going to be affected. And people in the LGBTQ plus community experience mental health issues at a higher rate. A recent study found that 61% suffer from depression, 45% have experiences and have PTSD symptoms, and 36% reported having an anxiety disorder. So, when we think about that, we also need to consider that there is no single answer for why these disparities exist, but stigma and trauma certainly do impact that number. Many LGBTQ plus individuals face, a lot of barriers towards getting quality health care, and many individuals are apprehensive to going to seek care because they fear discrimination or disrespect from providers. That rate is even higher with transgender individuals who say, I think the number was around 23% said that they don't see the doctors due to that fear of mistreatment.
So why do members of the LGBTQ community have more mental concerns?
Again, there's a lot of different factors that play a role, but members of the LGBTQ plus community may have to cope with stigma, discrimination, and violence. Many members can be and have been victims of hate crimes. They also have negative feelings about themselves because of their sexual orientation or gender identity. They may feel isolated or lonely. They might not have the support they need from their community or their family or friends even, but they also might feel the need to hide their sexual orientation or gender identity because of this. And think of the stress that places on a person. To have to hide this very important and integral piece of yourself can only result in negative impacts on our self-esteem as well as our mental health.
So what two mental health conditions are the most prevalent in the LGBTQ community?
While there are many, the ones that I'm going to talk about today are probably the ones that we see most often in the community. These include depression, anxiety, PTSD. There's also increased need for increased presence of substance use. Also, there is a higher rate of suicidal ideation and suicide attempt within the LGBTQ plus community. And there are certain risk factors that make them more likely to experience these ideations and to act on them. Some of those risk factors might be prolonged stress, rejection from family, friends. Maybe there's loss of relationships due to their gender identity or their sexual orientation. Maybe there is a history of substance abuse, which is a component that makes someone higher risk for suicidal ideation or suicide attempt. Exposure to bullying, exposure to trauma, exposure to violence, and also having a previously existing mental health condition can also impact someone's risk of suicidality.
So how does someone with identity affect their mental health?
So being able to identify and be accepted for who we are can lead to less feelings of anxiety and an increased feelings of self-esteem. So accepting our identity allows us to feel whole and have an increased sense of confidence. So being denied or invalidated of our identity can negatively impact our self-image and lead to low self-worth, which in turn negatively impacts our mental health. Think about how, it's a privilege to be a cisgender heterosexual individual in our society. We don't have to think about being denied our identity or being questioned or being shamed for who we love or who we identify as. So if we kind of put ourselves in that position and try to have like an exercise in empathy, think about how negatively our mental health would be impacted if we were constantly denied that basic human right to be accepted for who we are and be loved for who we are.
So how do you support that as an ally? If, those that are having issues with identity?
So some of the best feedback I can give is just to radically accept the person. Part of being an ally is understanding and asking questions and, letting someone disclose to you to their level of comfort. I work with a number of transgender clients in our health and wellness center, and they've told me that in their experiences, some people are very insistent on asking them where they are in their gender affirming process. And that can be really, really, again, the best word to use is intrusive. We have to let the members of the community disclose to their level of comfort. We can't force that out of them. So just letting someone be who they are and using their pronouns, that's a big one. Using someone's pronouns, the language that they use about themselves, mirroring that. That's a huge way we can be allies.
So how has the COVID-19 impacted the mental health of the LGBTQ community?
It's a really relevant topic. Obviously, we're still getting information, even in the general census of COVID-19, we're still learning new things every day. But the Human Rights Campaign actually did an analysis. They called it a general social survey in 2020. And what they found was that more than 5 million members of the LGBTQ plus community worked in jobs that were directly impacted by COVID-19. So these jobs included K through 12 education, higher education, hospitals, retail, food service. So already we see how they're impacted with financial insecurity. So that's a huge stressor. Those with underlying health conditions like asthma, diabetes, HIV, a lot of these individuals have compromised immune systems, and we're getting new information every day. So the stress of not knowing how COVID-19 is going to impact their health long-term as well as short-term, how it's going to impact their families. Am I going to bring it back to my family? Am I going to infect my family or my partner? That can be really stressful. And due to social distancing, a lot of the support groups that previously provided a safe haven for members of the community, maybe they stopped meeting altogether. Maybe they switched to a virtual meeting system, but nothing really compares to that in-person support. So it could lead many people to feel lonely or isolated or disconnected. Of course, we also need to talk about how COVID-19 has impacted our LGBTQ plus youth, which is such a vulnerable population. I was able to get some information from the Trevor Project, which is such an incredible resource. The Trevor Project is the world's largest suicide prevention and crisis intervention organization for LGBTQ plus youth, and they're so amazing, the work they do. And they did their own national survey. And in their survey, 42% of LGBTQ plus youth seriously considered attempting suicide within the past year. And more than half of those surveyed who reported having these suicidal ideations were trans and non-binary. So again, a vulnerable population within a vulnerable population. And more than 80% of those who responded to the survey said that COVID made their living situation more stressful because they found their home life and their family that they were maybe in lockdown with to be non-LGBTQ affirming. So again, they don't have the support they need at home. There's already a lack of access to care or an apprehension to get care. So again, we're seeing not getting treatment for these kinds of suicidalities, for these kinds of mental health concerns. It places them at a higher risk. So COVID really did kind of put into perspective that this is a really vulnerable population that needs support, especially even now that we're coming out of the tail end of COVID, hopefully. We really need to get the support, really need to get these clients the support they need.
So how can we be respectful of people who are members of the LGBTQ community?
What we can do is start by asking open-ended questions. Like I said earlier, allow the person to let you know what language, what terms, what pronouns they would like you to use. Of course, we are not perfect people. We are going to make mistakes, but it's important that we acknowledge when we've made a mistake, we apologize, and we are more mindful moving forward. We also need to allow the person to disclose to their level of comfort. Like I said, some people feel it's okay to ask invasive questions such as medical steps in a trans-identified person's process, and that can be really intrusive. So we need to also allow the member of the community to disclose to their level of comfort.
So how do we help someone who might be struggling?
So one way we can do that is to give support the way we would give anybody else support. Active listening is a really good tool to help somebody who may be struggling. And part of active listening is withholding judgment, making sure we clarify what the person is saying. Again, making sure that we reflect the language, using the right terms, the right pronouns, and, ask how we can help, whether it's through listening, whether it's assisting somebody in getting the help or the support they need. These are the first steps that we can take towards helping somebody in the community who might be struggling.
So how do you help a parent that may be struggling? So, a lot of times that parents are struggling with their loved one, coming out with their identity. How does a parent show they're being supportive without being I don't know if I'm saying this correctly, but they're struggling too, without being offensive that they're struggling with it too, in a loving way. How does a parent show that they're having a hard time, but they're trying to be supportive? How do they become an ally like that?
It's a great question, Ro. So one way is, again, just be present with the person, accept where they are in that moment. Of course, it might be very difficult for some parents to accept that their child might be part of the community. Maybe they have their own internal biases, their own stigmas, but just accepting the person where they're at, it doesn't change who they are. Just because someone's gender identity or sexual orientation doesn't align with maybe what you perceived or what you assumed, it doesn't mean that person is not the same person that you grew up loving, that you raised loving. It might be hard for some people based on cultural matters. Maybe there's different cultures, religions that might not be so accepting, but just being present with the person and utilizing resources such as PFLAG, Parents and Friends of Lesbians and Gays. This is an amazing resource. We do have PFLAG in Bergen County, and this is a place that provides support groups for individuals who are parents and friends and loved ones who have members of the LGBTQ plus community in their lives. They help people understand, how can I talk to this person? How can I support them in their coming out process? Because the coming out process isn't just one particular incident. People may be going through the coming out process consistently in their lives, whether they're coming out in their personal life, their professional life. It's not a one-time thing. So just constantly being present and being with the person and letting them know that, maybe I don't understand it, maybe I don't get it, but I accept it. Letting somebody know that they are accepted regardless of how they identify. They're still that person.
So how does prejudice and discrimination impact mental health?
And this is a huge concern because, the LGBTQ plus population does experience a lot of prejudice and discrimination. LGBTQ plus individuals are more likely to be victims of violence compared to their heterosexual peers. So they do experience what is called minority stress. And that is when minority groups experience stress stemming from experiences of stigma and discrimination, which in turn places them at risk for a number of physical and mental health outcomes, negative outcomes, most likely. LGBTQ plus people experience many forms of minority stress and share that with other marginalized groups. And that might be things such as discrimination, expectation of rejection, and prejudice-related life events, such as hate crimes, as well as unique stressors to the community, which could be something such as identity concealment and internalized homophobia. And we also recognize that LGBTQ plus individuals may have less social support than their heterosexual peers.
So how can we be a better ally in the community?
And that's a great question. And that's kind of, I think, what many of us need to focus on this month. Even if we're not a member of the community, we need to focus on how can I be a better ally? And the best advice I can give is be open-minded and willing to talk, ask questions, and above all, listen. All people, regardless of gender identity and sexual orientation, should be treated with dignity and respect. Confronting our own biases and prejudices can be uncomfortable, but we need to put in that work if we want to be effective and present allies. Personal growth plays a role in our ability to show up for our LGBTQ plus peers. Having an understanding of sexual orientation, heterosexism, and the distinct challenges that our LGBTQ plus peers face, and we need to advocate for them. Understand, get some knowledge, research, read. We need to do these kinds of things in order to be able to advocate effectively. And the most important piece that I hope that everyone can take away from this, especially if you are not a member of the community, is know that empowered ally relationships, the person in the non-oppressed role initiate the change towards personal, institutional, and societal justice and equality. So the non-oppressed person would be us, would be maybe those who are heterosexual, those who are cisgender. That's our obligation to the community, to advocate for them, because we're the ones that initiate the most change. It's an unfortunate truth, but we're the ones who help that change happen.
And it's more than just, wearing a rainbow flag. It's making them part of our everyday, we love you, and it's accepting,
Yeah. It's great when we can go into Target and get an ally t-shirt, but, there's much more. Like you said, it's a three-dimensional thing. There's an obligation to learning more, to doing more, to being present for our peers and showing them that, hey, even though I don't have your same lived experience, I'm here with you.
Mm-hmm. So what are some resources that our LGBTQ community can use if they're approaching a crisis?
So there are specific crisis lines for the LGBTQ plus community. Like I said earlier, the Trevor Project is probably one of the most well-known ones. That's specifically for LGBTQ plus youth. That is a 24-hour crisis hotline. It's a text line. So that's a really great resource for youth. There's also the LGBT National Help Center, which is a website that has a lot of different resources that can include text lines, articles. Those can be really helpful for individuals who might need help coping in the moment. But if we are talking about something that's more in the moment and in getting to the point that we are at crisis, especially if you're a Bergen County resident, we do recommend calling 201-262-HELP. That's our crisis screening line. There's also the National Suicide Text Line. You can text now. There's also a hotline, but the text line is 741-741. And you text the word talk, and you can text somebody while you're in crisis. But there's also a various numbers of other resources. You know, NAMI actually on their Instagram page, I follow them on Instagram. I'm very mental health focused on my feed, but NAMI just listed a huge number of resources for different, you know, members of the LGBTQ plus community. You know, there's the Trans Lifeline. There is specific resources for the elder members of the community. You know, they posted that on their Instagram today, and it has everything, just bullet points, strict to the point, contact information. So using your social media presence can also be a helpful tool.
Of course, of course. And finally, I want to thank you for, you know, joining me today, giving me some great pointers and tips. And, you know, this was really, really informative on how to be an ally. You know, it's really important that we are supportive this month and every day, and, you know, really make an impact to our, you know, our community members, you know, and be inclusive, and how important it is to be inclusive. You know, if you'd like to learn more about our foundation and about the medical center, please visit our website at newbridgehealth.org. And thank you again, Darian, for joining me today, and for the great talk. And thank you again.
Thank you. Thank you for allowing me to kick off Pride Month with you.
All right. Thank you. Take care.
Take care.
Bye-bye.